Well, hey guys, let's talk hair loss. It's no secret that hair loss is very distressing to go through. There are many types of hair loss out there, and knowing what type of hair loss you have is so important because that's what's going to influence what type of treatments are going to actually help you. Now, most of my videos on this channel related to hair loss talk about the more common type, which is called androgenetic alopecia, basically related to hormones and genetics, causes the hair to turn into a little baby hair, and that's what leads to, well, pattern thinning. However, today, I want to focus on a type of hair loss that really gets no attention in the public. It's called frontal fibrosing alopecia. It's very important to know about this hair loss condition because if treated early, it can be stopped from progressing to scarring. So this is a type of hair loss that we call a scarring alopecia. If it goes untreated, the hair follicle will scar down, and once it scars, it can never, ever grow a hair again. So the treatment can prevent that from happening, but the earlier the treatment is started, the better the chance of saving that hair follicle from this hair loss condition. You get hair loss along the hairline. It presents as a receding hairline in a band-like pattern of hair loss, but it can affect hair anywhere, including your eyebrows, your underarm, your arms, your legs, even your pubic area. And men might notice that in the beard area, they start to get patchy hair loss. Typically, frontal fibrosing alopecia starts out very slowly and it progresses gradually. That's why knowing about it is so important, because if caught early, then the hair loss process can, in many cases, be halted and prevent you from going on to have spread of the hair loss and scarring, which again, once that scar forms, there's no turning back. A lot of women with frontal fibrosing alopecia, it will come to their attention first because they start to notice loss of the eyebrows. About 80 to 95% of women will have loss of their eyebrows. And each year that passes without treatment, you will get gradual expansion of that band of hair loss, and it can extend, back all the way to the center of your scalp. You can also get, ongoing loss of the brows, can completely scar down. You may notice hair loss again in other body sites like the arms, the legs, the underarm, the pubic area. Will it go away on its own? In the vast majority of cases, it will not. It won't just go away for most people without treatment. However, there are unicorns out there. Some people, their frontal fibrosing alopecia, it kind of comes to a halt. It stops and it burns out. But if they have developed any scarring, well, there's no turning back for those particular hair follicles that have formed a scar. That is what the treatment that we'll talk about later on in this video is all about, stopping the scarring process before it begins. The reason I'm so passionate about sharing this information is that with this process of hair loss, the sooner you start treatment, the better the likelihood of getting successful outcome with the treatment. If you delay treatment, trying things that are promoted online, different natural remedies, different serums, stuff that you buy at the store, all kinds of things, you are not only spinning your wheels, but you are sabotaging your chances of success with the treatments that we know actually can work, because the longer you delay getting the appropriate treatment, those treatments don't have as good of a chance to help prevent the scarring at that point. What are some signs that you have frontal fibrosing alopecia? Again, gradual receding of the hairline, because this is a hair loss process where you have inflammation that comes in around the hair follicle. And that's what's eventually going to scar that follicle if you let it go untreated. So as the inflammation is coming in, it can cause symptoms before the hair is even lost. You can have itch and pain in the scalp. Any patient who comes in saying my scalp is itchy and painful, it could be an early sign of an inflammatory hair loss process. So a good scalp exam is going to go looking for some additional possible signs, and if necessary, a scalp biopsy might be pursued. So don't ignore signs and symptoms of scalp itch, scalp pain. It can be a clue to impending types of hair loss, as well as other scalp disorders. Now, in addition to possibly having itch and pain, you may have some discomfort with combing your hair, moving your hair around, like as you part your hair, you may find, gosh, my scalp is very tender when I do that. that can be a sign that you've got inflammation in that follicle. It can be a very early clue. A rash around the hairline. Not always, but in many cases they do. And also in the brows as well. The rash is usually located around the hair follicle. You can have even these little bumps. It's a really common finding, actually. Little tiny bumps, like you run your finger over this part. It's kind of hard, you know, without a magnifying glass, because it is, you know, a normal hairline is a little bumpy there as you feel the hair, but it's real bumpy, and you feel like this little rough, gritty stuff. When we look really carefully at the hair follicle, you can see like little bumps around the follicle with like the scaly stuff on top. And again, that can happen in the eyebrows too. Like I said, the majority of cases, women will also have some degree of brow loss, and that is very often the first presenting clue or complaint. That's often what brings patients in. And over the years, I've gotten a lot of questions from you guys about brow loss, thinning brows. Do know that this is a possible cause of brow loss, and it's also a manifestation that you might also eventually be having hair loss as well. So how does it present in the brows? Again, you can have those little rough bumps. You can have just noticing that your brows are thinner. You may also notice that the tail of your brow is thinning out and that you're losing it. Frontal fibrosing alopecia is not the only cause of loss of the outer part of your eyebrow. There are other things like thyroid disorder, atopic dermatitis that can be associated with that as well. As a side note, I have a video all about the different causes of thinning brows, which I'm gonna link down below in the description box. But frontal fibrosing alopecia is one reason for loss of the eyebrows. And again, it's so important to pay attention to this and to know about this condition, because guess what a lot of women are gonna try when they find that their brows are thinning and they're getting loss of brows? Those brow growth serums that you can buy without a prescription. Trying those things not only is not the right thing, it's not going to address the cause, the issue, it's not going to even have really a fighting chance of growing the brow hair with that inflammation going on, but you are losing time in which you could be using something that is actually specific for this to help stop the process. The over-the-counter brow growth serums, usually containing, not always, but in the majority of cases, contain something called prostaglandin analogs, similar to, you know, bimatoprost, which is what Latisse is. They have, you know, other forms of those, and while those can be effective for brow growth, for sure, they're not right for this condition, and they also have side effects, irritation, discoloration of the skin. But not only are they not right for this condition, because they can cause irritation, guess what that can do? Bring in more inflammation into the skin around the follicle and hasten the hair loss process that eventually leads to scar formation. This is why, again, I'm so passionate about talking about this with you guys, because, you know, it's something that a lot of people don't realize. They kind of think, oh, I heard this is good for brows, I'm gonna try it out. But if your brow loss process and or your hair loss process, the condition you actually have is frontal fibrosing alopecia, not only are those things useless, a waste of money and time, but they can actually worsen the condition for you. But anybody who is dealing with any type of hair loss, noticing that their hairline is receding, needs to watch this video before you go pursuing different things for your hair loss. You can also have little small red bumps on your face. That is often a co-occurring phenomenon with this as well. Not everyone has that, but it's another clue. Another thing that can happen with this, and it's a clue, it doesn't always happen. If you're someone who has snow white gray hair, like you have complete gray hair, if you have some of these other symptoms that I've mentioned, receding hairline, losing your brows, and you also notice that some of your hair is actually going back to your original hair color before it turned gray, that's another sign, because as that inflammation is coming in around the hair follicle, sometimes it can just activate pigment production. And so you might think, oh my gosh, am I getting my hair color back? But no, it's just a temporary thing, and it's usually only a few hairs. It's not like all of your hair going back to its original color. What the heck causes this anyway? Well, as I said, what's actually going on when you biopsy early on, what you're gonna see is inflammation around that hair follicle. So why does the inflammation even come there? Honestly, it's an area of very active and ongoing research for which we don't have a "this is why you have it" answer. It appears to be related to a mix of your genetics, of course, we can always blame things on that, hormones, another thing we can always blame things on. And I say that because it very commonly presents in women with menopause. And also just inflammation in the body. Those three things together, working together. It's not uncommon for patients who have frontal fibrosing alopecia to also have certain autoimmune conditions. They appear to often, although not always, to often come together. So a lot of patients with this also tend to have, may have vitiligo, an autoimmune disease where it attacks the pigment producing cells. As a side note, I do have a video all about vitiligo, so check that out. It also may be common in people who have hypothyroidism. As a side note, I have a video all about skin signs of hypothyroidism, and also patients who have lupus. An autoimmune disease. Risk factors for frontal fibrosing alopecia are menopause. Again, that hormonal component likely is playing a role there. If you have a close blood relative, like your mother, your sister, aunt, that has frontal fibrosing alopecia, that's a risk factor. If you have, again, hypothyroidism, thyroid disease, if you have rosacea, appears to be a risk factor, and if you have type 2 diabetes, those are risk factors that are, associated. Association doesn't, equal causation. When a patient presents with signs, symptoms concerning for frontal fibrosing alopecia, scalp biopsy. Biopsy is almost always done to really assess what's going on and also to rule out other hair loss conditions. Here's the thing that's also really important to know. Many patients, not all, but many patients who have frontal fibrosing alopecia, that have a 2-for-1, meaning they have other types of hair loss as well. So for example, you can have frontal fibrosing alopecia and you can also have androgenetic alopecia. It's a very common hair loss process. So you can have both things going on at the same time. So a lot of patients may have been diagnosed with androgenetic alopecia, but they also have frontal fibrosing. It's important to recognize it and treat it, not just treat the androgenetic alopecia, because androgenetic alopecia is not scarring. You can get those miniaturized follicles to wake back up and grow hair, but once the frontal fibrosing scars the follicle, again, there's no turning back. Your hairline can be receding and you can have thinning up here. The thinning could be reversed because it's androgenetic alopecia, but if this goes untreated and scars down, once you have that scar, that's what we're trying to prevent. A lot of women will have traction alopecia and will also have frontal fibrosing alopecia. Traction alopecia is hair loss related to chronic traction on the hair, related to tight hairstyles, or if you wear your hair frequently in like a scarf, anything that puts traction. If you get extensions, I have a video all about traction alopecia, and in that video I outline how to change up your hairstyles to avoid traction hair loss, because with traction, the pulling of the hair, it's something that once you stop that tight hairstyle and switch up your hairstyle, the hair can, resume growing normally. But if you continue to put traction there, eventually the hair follicle can scar down. But you can also have frontal fibrosing on top of that. And with traction, it's pretty common to have that right here. So you have thinning here, but if you're not, if you don't get a good scalp exam and you miss, well, the patient's got, redness going on up here, a little bit of inflammation, what we call perifollicular papules with overlying scale and receding hairline. Well, you need a biopsy there too, and look what's going on. Make sure they look at your eyebrows, examine the rest of you, arms, legs. This is why when you see a dermatologist, I'm so passionate about this, when you see a dermatologist for a skin problem, a hair problem, it's so important that they examine all of your skin. In today's climate, where we have such little time with a patient, it's something that gets glossed over because, you have back to back patients. You get, ideally 15 minutes, but that ends up being 35 seconds, it feels like. So getting undressed and doing a complete skin exam, it's ridiculous that it has become challenging to do like one of the core tasks of being a dermatologist, examining the skin, but I'm telling you, it's so important, especially here. Like, there's an opportunity to look at the hair, the pubic hair, and see is there any hair loss that you might not notice. You know, that can help build a story for this, and it really can make a huge difference. So don't be freaked out if your dermatologist asks you to get undressed and you're like, I'm here for my hair. But I'm telling you, you can have hair loss in places that you're not aware of, and it can really help. Or other skin findings that can support not just this type of hair loss, but other types of hair loss. Because like I said, there are so many types of hair loss we haven't even talked about on this channel that, you know, a complete skin exam can really help build a story for. So once it's diagnosed, how exactly is it treated? I want to emphasize this. Treating it, the sooner it can be treated, the better the likelihood of stopping it, of preventing it from progressing, and the better the likelihood of your hair regrowing. Also, treatment can help to alleviate those symptoms of pain, itch, discomfort in the scalp. When it comes to treating frontal fibrosing alopecia, there is no one best treatment. Usually, a combination of treatments are pursued to get control of it, to stop the hair loss process. And usually, you need to stay on the treatment in order to keep things controlled. There are two medications that we typically offer men with pattern hair loss, androgenetic alopecia, but in menopausal women can also be offered and be effective for frontal fibrosing alopecia, oral finasteride and oral dutasteride. They can be helpful. You can get some regrowth on these medications. Then a mainstay treatment for this is steroids. Applied to the skin of the scalp, applied here to your eyebrows possibly, as well as injected. Intralesional. So we can numb the area and inject steroid medicine directly in. And that is key, because you want to get down there where the hair follicle is and shoot that steroid in there to silence that inflammation and make it go away. You can get hair regrowth at that point, and again, and prevent scarring. You want to get rid of that inflammation. So that is definitely a mainstay. And you can inject the brows and you can get regrowth. Brows typically can regrow within 3 months. Depending on where you're at in the hair loss process, you can start getting brow regrowth usually within 3 months of getting, starting to get steroid injections there. Like I said, usually a combination of things are offered. A medication that can help a lot, actually, especially if started early in the process, is hydroxychloroquine. It's actually a drug to treat malaria, but it is really helpful for a variety of inflammatory skin conditions. It's used to treat lupus, and it can work for this. And again, patients can get regrowth of their hair. Again, it can either help with regrowth or at least stabilize the process. So stop the hair loss process, stabilize things so you don't lose any more hair. There is a laser called the excimer laser, and it can actually target that inflammation, silence it. Minoxidil, of course, I have a lot of videos on this channel talking about. It's a medication that you can apply to the scalp, the brow area, or you can take it by mouth. It's FDA approved for androgenetic alopecia, but it certainly can be beneficial for frontal fibrosing alopecia. A lot of patients end up on a combination regimen of oral finasteride and topical minoxidil. And that can definitely be helpful. Again, the earlier, the better. So those are some of the treatments that can be offered. Talk to your dermatologist, talk to your dermatologist, talk to your dermatologist. I'm gonna say that over and over again because communication with them is so important when it comes to getting this under control. As I said at the beginning of the video, there are so many things you're gonna hear about when you go online, when you go on social media. Stuff is gonna get targeted to you as soon as you Google this, okay? If you found this video, you're probably already getting targeted a lot of hair loss stuff. So, that's just the nature of how the internet works. It doesn't always mean that the information that you are being shown is the best thing for you. So keep that in mind, like you're gonna see a lot of things, try castor oil, try this, try that. But remember, not only are you spinning your wheels on something that is not meant for you, but you are losing out on time for an effective treatment. And you know, you can get to a point where the effective treatments, you know, you've lost that window of opportunity and you've got a scar. That is what you want to avoid. My other tip is, when you are seeing your dermatologist, you have a treatment plan, make sure that you fill your prescriptions on time, because you don't want to miss your treatment. Delayed treatment can wake that process up again and make it less likely that you have good success with your treatment. Don't try anything without talking to your derm first. Like I said, again, there's so many things out there. Hair loss is distressing. You get really desperate because nobody wants to go through this. Not only might some of the things that you might be curious about not be right for this, like not, you know, do anything, but they could be more inflammatory and hasten the process, which is the last thing you want to do. Anytime you get tempted to try something, I want you to just close your eyes and picture that follicle inflamed, okay? And you don't want to put more, you know, you don't want to kick your follicle when it's down. Like anything with hair loss, patience is key. It can take a long time for treatments which are effective to really start working, because the hair growth process is a slow process anyway. So you've got to be patient and you have to stay consistent. Some people, you know, it's going to take, you know, on average 6 months in many cases after starting treatment before you really start noticing much improvement. Anywhere, you know, a lot of patients 18 months. Again, you know, it takes time for things to start working. So you have to be patient. Don't bail on things because you're not seeing results. If you feel like you are developing side effects or you're concerned about a certain aspect of a medication, pick up the phone and call your dermatologist about it, because, you know, if you stop the treatment, then that inflammation is going to come right back. Be really gentle with your scalp. No scrubbing with brushes, because again, it's gonna bring in more inflammation. Try and do real gentle hairstyles, loose ponytails, loose braids, you know, not only for cutting down on traction hair loss, but also here, you know, you wanna reduce inflammation. One thing that will hasten the accumulation of inflammation into the scalp and, you know, push this over the edge and accelerate things is a lot of heat styling. So try and back away from blow drying your hair, using hot combs, hot tools. Not to say you can never use those, but be real conservative with them. Use the lowest heat setting possible. Really just try and avoid them as much as you can, because it really can aggravate this quite a bit. Also, you want to avoid wearing things that put a lot of friction here, like those headbands that are really popular, that can, you know, cause a lot of friction and aggravate this. I really hope this video is helpful to you guys. I don't want anyone struggling out there feeling bad about themselves because they have this. You're not alone. In fact, you can even join support groups, which I highly encourage. There is a Scarring Alopecia organization. I'm gonna link it down below in the description box. I'm not affiliated with them. Just support groups that, you know, whether it be this hair loss condition or others, because you will find that you're not alone. And that can really be very beneficial in the long run. I hope you guys enjoyed this video and that it was informative to you. Share your stories in the comments, because again, that can really help people out to hear and see that they are not alone. On the end slide, I'm going to link a recent video I did about a hair loss sign not to miss. So check that one out next. But if you guys like this video, give it a thumbs up, share it with your friends. And as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.